Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hello, welcome to the weekly podcast of the Common Sense MD. I have a special guest here today, Scott Fitzpatrick, who's been here before. He's the noted acupuncturist in our region. I would say you're by far the top acupuncturist anywhere in our state. I'm going to brag about you.
I'm
not going to say region. I'm going to say state and maybe southeast.
If we're going by volume, it may be the number one in the United States. I'm thinking.
He is so experienced, does so much work. I like to characterize him as a former baseball player turned acupuncturist.
Yes.
And part-time hippie, part-time
Yes.
musician,
Yes.
all-around Renaissance man. He's
Man.
an incredibly interesting guy that I love to talk to. As a matter of fact, he cures about everybody in my office with acupuncture, especially my migrainers, migraine headache people. He's amazing.
Yes, sir.
I can't sing your praises enough for some of the things, the tricky things that we see in my practice. If I can't get somebody to quit hurting, because as you know, my practice is mainly baby boomer population.
Absolutely.
And either they come to me with pain or fatigue. Most people that get old, they're tired or they hurt somewhere.
Yeah, and usually it's both.
Usually both. In my case, it's both.
Yeah, you and me both.
But in any event, last time we talked, we did a podcast. It's been over a year, I'm sure. We wanted to do one on fascia.
Yes, sir.
Because if the fascia, that part of your body, the connective tissue, is very complex and so underappreciated. Yep. And that's why I wanted you to talk about it, because you're an expert in fascia. You're just amazing in what you can do as far as turning around people that have a lot of chronic pain in their muscles and joints.
Yes, sir. Yes,
Acupuncture is tremendous, but now you're doing this stuff that also involves fascial planes.
Yep.
Talk to me about fascia. What is it?
I can tell you, certainly my practice is evolving. It is evolving, and I think the further we get into this, the more we appreciate the complexities of fascia. But the newest definition of fascia, the old definition was it's connective tissue that wraps around the muscles. And now the actual working definition is it's any structure in your body that reacts to a mechanical stimulus. And when you hear that, you think, golly, can they be a little more vague?
Yeah.
What exactly is it? And it's literally everything. And since our last podcast, which we had great feedback from. And when I was telling people about doing this fascial talk, people were really excited because even today, seeing my patients today and yesterday, all of these fascial issues, none of them have a clue what fascia is, and then so we start talking about what you've seen with fascia. And most people understand this. The first concept is when we talk about how the fascia wraps around a muscle. And so if you're going to make some chicken breast for dinner and you go to the grocery store and you buy it and you open it up and there's a silver kind of lining around the muscle, that's fascia. And we've all known that. So, going through medical schools, and I know when I was in school, we talked zero about fascia.
No, we didn't either.
And you probably didn't much either.
We dissected our cadavers, and you had to peel through these layers of fascia, but really we
didn't pay attention to
about what it was there for.
Didn't pay attention to
it. It seems to hold things together. It's all I kind of.
It holds things together, and the funny thing is now they're actually describing the Chinese meridians and pathways are actually woven through the fascia, which is just fascinating because that's kind of the newest research too. So what the newest working definition of fascia is just that it is involved in almost every cell in your body, and it has multiple functions, and it comes in many different iterations, but it's always composed of three things: collagen, elastin, and then this granulated substance. It's a ground up substance that you and I have seen before, which would be like a granulomas or a soft, yellowy kind of fatty tissue. So and a lot of times we'll get that if someone gets a scar, and you'll get this granulated tissue that kind of fills in, and that's why a lot of times now surgeons will leave a wound open so that granulated tissue, this thick tissue, which we know is part of the fascia, won't stay and form these knots inside there, and they'll push out. And so as your body heals, some of that fascia, which is, we'll find out later, is just part of the healing process.
Yeah, my dad used to call it healing by secondary intention.
Okay.
As a surgeon,
wouldn't you love to have his knowledge and have that discussion?
But a lot of times when you have
Yeah.
a terrible wound, you do let it kind of granulate in by itself.
Yep.
If you don't want to close it, or if it's been open too long, or it's infected, it does have a way of healing itself, and you wonder, how is this doing this by itself?
Doing it, yeah, and come to find out, it's one of the types of these six. There's kind of six major categories of different types of fascia, and we'll talk about those just a little bit. We won't go too far into it, but one of those you'll find in this brand new. It's a soft fascia that you find in brand new scars, certainly after surgical procedures, but you'll also find it in the thymus gland. You find it makes up the spleen. And you think about this in doing cadaver studies years ago, some of the organs that you pull out, some are really super soft, and they would just kind of fall apart when you grab them, and some are super rigid. And all it is just the different types of fascia. And the reason being is because all of that fascia, having the collagen, the elastin, and this granulated tissue, it's in different amounts. So some of it's going to be way more rigid. Some of it's going to be a lot more flexible. Some of it's going to be really, really kind of soft and pliable. So think about this. Fascia is going to be some kind of a combination of soft tissue. Sometimes it's firm. Sometimes it's tight. Sometimes it's laxed. Sometimes it's a filler, and it has all of these incredible uses for our body. Without it, it really holds our body together. It's the structural glue for our entire body. It's just insane, and we never were really taught that. It's
and the fact that it has different purposes, depending on where it's at, is what fascinates me.
It fascinates me too, because and I thank you for kind of really triggering me to do a lot more research on this. But after our last talk, I thought I knew a lot about it, but I really didn't know enough. So and to say I'm an expert, I think would be an egregious overstatement, but I certainly thanks to your kind of prodding, I did, and Robin, she's a physical therapist, have done a whole lot more work on really getting into this, and I think it's helped us in our practice, because we see this stuff, like you said earlier, that a lot of the Western medicine doesn't love to see, or you've kind of reached the medical end of what you can do, but there's more. So like we'll see the complex shoulders. Somebody's had a shoulder surgery and you've seen this 1,000 times, maybe 10,000 times, like I have. You'll have somebody come back from an orthopedic surgeon, and they'll say, "Hey, hip looks great. Go see your family medicine doctor.
Yeah.
Tell them it still hurts." And that's the cycle that a lot of the patients get into, and that's when I get them. Yeah. Because that's when you see them, you say, "Well, hell, let's try some physical therapy." And they'll say, "Well, Dr. Rogers, I've done PT 4 times."
Yeah.
And I say, "Well, shoot. Well, let's try some acupuncture." So what we're doing now with the acupuncture and physical therapy, and certainly medications and things like that, is just trying to do a better job of treating these underlying fascial issues with the therapies we already have that we know work, but doing a better job of tailoring them for specific fascia. Yeah.
A lot of times, don't you just want to get in there and work something out on a patient? You're sticking needles in people all day long, but you're more than that, because you're doing therapy on them.
Yes, sir.
Because that needs to be worked
Something
out.
has to be done. Yeah.
I really like massage therapists.
Absolutely.
Especially the ones that know about the fascial planes and what they're doing. I know, for example, my daughter, who's an esthetician, does this procedure on people's faces called oil therapy.
Okay.
And she uses an ultrasound machine to look at that SMAS level of where the ultrasound beams need to be directed to for growth. And it's very technical, but actually she's looking at that fascia.
She is,
and
yeah.
she's stimulating it, and it helps plump people's face up. It helps regain some of the structure. So that's one mode. But there's a lot of ways to get at this thing, I'm certain, besides acupuncture and massage therapy.
Yep. And I think ultrasound is a wonderful thing. I think trigger point injections and all of these things. And this is such a vast discussion. I think that's why you and I were talking a minute ago. This is going to be at least a two-parter.
Yeah, we're going to have a two-parter.
And we're going to try, and I'm trying not to speak in circles, and I'm trying not to be too overly excited, because it's such a fascinating thing to treat chronic pain. And, you know, like I told you just before we signed on here, there's a reason why, even talking about fascial dysfunction, people have fibromyalgia. There's a reason why people have depression with
every time
with dysfunction from their fascia. And you know, so trying to circle the wagons and not get too far ahead of ourselves. I think it you know, just maybe talking about just a couple of the major functions of the fascia. You know, number one, movement. So and you know, we can kind of dive into movement. Let's talk what we all see more than anything in the world: lower back pain.
Yeah.
Just the simplest description of this lumbar spine pain that we've all seen, and you can have MRIs and CT scans, and you can see herniations or nothing. You can see, you know, broken bones or nothing. But a lot of times the pain is exactly the same. And what we're seeing now is that it's probably because of the nerve endings inside these layers of fascia that are actually causing the pain. So now it's like, well, why is it causing that pain? Well, because it's that fascia is in charge of movement. So let's go back to the chicken breast. The chicken breast has this silver lining around, or turkey leg. You know, you'll see that silver lining. You'll peel it off, and you can almost see through it.
It's very thin.
Very thin, yes, sir. And that particular type of fascia is going to be a fascia that's pretty rigid, because it's trying to keep that muscle in one spot. If you think about it, it wants that muscle to only move in one plane. And I think a great way to think about that is just a simple bicep curl. When you curl your arm, and we'll go simple math here. We're just going to say the bicep is one big muscle. So we're going to curl, and you know what muscles you're using the bicep. You're bringing your arm up, and within that, you want that fascia to be tight and to keep this muscle in one plane, so that when you fire it, it pulls your arm here and doesn't go this way or this way. It comes in one particular motion. But what's fun that we've been getting into and understanding, and this is going to circle back to the lower back in a second, but within that bicep, you know, as I do, there are maybe 100 different little muscles in there, maybe 1,000 little muscle fibers inside there. And every single one of those things have a fascia lining around them. And they have that in order to allow that muscle to slide within itself. And the reason that is because if I give you a pencil and I say, hey, Dr. Rogers, curl that pencil for me as many times as you can, you're only using a really small amount of the bicep, but it looks like you're using the whole thing, because the whole thing's flexing, but only a few of those muscles are sliding inside and out. The rest of them are at rest. That's why you can continue to do it for a long time. It's crazy. Dr. Rogers, I'll give you 100 pounds. Curl that for me. You can curl it once, but all those muscles are still moving in that same exact plane. But now you've recruited all your muscles, which is why it's so important to, when I explain this, when you talk about lower back pain, you have layers. And I guess a good way to describe the way this fascia looks is almost like a spider web. So if you can imagine in your lower back, you've got a couple spider webs stacked on top of one another. And on these spider webs, there are muscles attached on all angles. So when, if you bend over to touch your toes, that spider web is going to pull out, multi-directional type fascia, and it's going to come back to hopefully where it's supposed to be. And that's really what its job is, because that's not what the muscles do. And the muscles are the energy, but the fascia helps store the energy. So as you bend over and touch your toes, that fascia stretches, and then as the muscles relax, hopefully, and that fascia hopefully will return back to where it's supposed to be. And that's in a perfect kind of lower back or movement, or with your bicep movement or whatever. The problem we get into with wear and tear with age, with surgeries and things of that nature, these layers of fascia start to get stuck to one another. That's where the problem is. So now, I've my 100 years of throwing baseballs and swinging golf clubs. Now this bicep's a little stiff. It's not moving quite as well. It's not as hydrated. There's probably some trauma in there. And the same thing, we see it all the time with backs. Complex backs, complex shoulders. People have their shoulders fixed. The hip pain we talked about earlier. This fascia has to be returned to some semblance of normalcy and some semblance of fluid movement.
Yeah.
And if we can do that then with headaches, kind of chronic migraine headaches and daily headaches and things of that nature, if we can return that fascia, because the fascia wraps around the brain. The fascia wraps around the little blood vessels inside the brain.
Nobody ever thinks about that.
No, they don't. And you think about it, just around the little blood vessels inside the brain, they're spasming, giving people migraine headaches. Somehow we've got to turn those off and make them go back to for lack of a better term, a normal place, back to where they were before they went into a spasm, or before they got stretched or torn or cut or ripped or whatever it is.
And so you're saying each of those myofibrils in your muscle is surrounded by its own fascia. It's not just the whole thing like you'd see on a chicken.
Yes, sir. Yeah, it's crazy, and we never would have thought of that.
No.
But it makes perfect sense when you think about it, which explains why we can pick up a pencil and not pop ourselves in the forehead.
Yeah.
Because you don't need 100% of your bicep to do that. But you're going to need 100% of your bicep to curl that 100-pound weight. I'm sure you can probably still do.
I would go more with 50 right now.
I was like, 100 sounds a lot.
No,
I should have said 50,
100.
but a 50. But that's what's so fascinating about this. So, and being in pain medicine, which is what I've done for so many years, and getting a better understanding, because I think I've evolved and become better and better at treating pain.
No doubt about it.
And I think this has really helped us do an even better job of treating some of the things that just weren't responding so well.
And so the acupuncture combined with treating this fascia sounds right.
Yep.
When you think of those fibromyalgia patients, which every doctor hates seeing coming in because, number one, there's no test to tell you they have fibromyalgia, although it's a known disease.
Yes.
It seems to be always tied in with anxiety, depression, almost trauma sometimes, almost every time you can
almost always
elicit that out of it. But the idea that these muscles and this fascia have nerve endings
it's crazy.
that need to be treated is just really interesting to me, because there's got to be something better than what we're doing to treat pain. Just by masking the pain with these pain medications, even anti-inflammatories, they're not really that safe for long-term use, in my opinion.
Right. They have a place. Yeah.
They have a place.
Yep.
I was even reading yesterday about there's some orthopedic doctors that are doing a little different kind of surgery on knees and joints, where they go in and they ablate the nerves. Kind of like you heard of heart ablations,
sure,
where they disrupt the electrical signal. So, our body is made of electrical signals, and that's what you work with all the time,
all day long.
And that's what you're doing. You're not only sticking a needle in there. You've done it on my back. I have a bad back, and you're putting electricity in there.
A little bit, and it's that, and it's. But I think taking it just a teeny bit further is just the importance of appreciating something about electricity, which is electricity needs water, needs hydration. And what I see a lot of times, and I think what you see a lot of times, it's very common for you and I both to look at someone and say, gosh, well, you're obviously dehydrated. But now what we're seeing now is it's not just the obvious signs of dehydration. If I look at someone and say, they're walking hunched forward and they've got a cane, their back's killing them, they're kind of dehydrated in that fascia in the lumbar spine. So I think there's some ways to increase, it's hyaluronic acid. I'm sure I'm saying that wrong, but hyaluronic acid is what has been shown to be the lubricating factor in between the fascial planes. So increasing hyaluronic acid, and I think when your daughter does some of her stuff with the aesthetics, she's increasing collagen, she's increasing warmth, which fascia loves, and she may be increasing some of this hyaluronic acid, because I know there's some supplements, there's some
supplements,
foods,
and also we inject
foods.
hyaluronic acid. As a matter of fact, these orthopedic doctors that are doing these new kind of knee ablations to take away chronic knee pain, trying to avoid a knee replacement,
Right on.
or ablating some of the nerves on the surface of the cartilage, but they're also injecting hyaluronic acid in there, which is the part that hydrates, makes everything slide evenly. That's another reason why, when you're talking about hydrating muscles, that's why I recommend every adult, unless you have some unreasonable reason not to do it, is to take creatine.
Okay.
Because creatine, which everybody thinks, well, I'm just gaining water weight with that, but what you're doing is hydrating your muscles.
Right.
That's what creatine does.
Right.
So when somebody takes creatine, they may gain a couple pounds in 2 weeks, and they say, well, it's just water weight. Well, it is water weight, but it's hydrating your muscles.
It's functional.
So they work better.
It's
And
making things move better.
Creatine does not hurt your kidneys. That's a misnomer.
If you take 47 pounds of creatine a day, that might affect your kidneys.
That's exactly
But
right.
in recommended doses for healthy adults, it's a really super safe supplement.
I recommend it highly. It also, at a little higher doses than the typical 5 grams that we use for muscle building. We use 8 to 10 for bone health, and sometimes up to 20 for brain health. So creatine is very healthy for your brain.
Right.
It's another one of those factors that I use personally and in all my older patients to maybe stave off dementia,
Okay.
along with some other things that we do,
Lots of
like
other
methylene blue, lithium orotate. There's a lot of good supplements that you can do that play into part with this, but hyaluronic acid is definitely one of those supplements that most people take.
Yeah, and maybe don't know exactly how important it really truly is. It's so I've really become kind of fascinated with the these whole fascial planes and again we'll get into more of kind of the treating them later, but I just want to make sure that I think that people get a little bit better appreciation of the complexities of the fascia. Go back to the knee. You're going to have a total knee. They're going to cut the skin, which is the fascia. Think about just under the surface of the skin. There's one thick layer of fascia that wraps around your whole body, just like a wetsuit. Why does it do that? It does it for a couple of reasons. One's to repel water. So water, it's a wetsuit.
Yeah.
And to keep the water out and to keep water in. It's really, really important to keep that fascia. And I see this a lot when I'm teaching residents. Like I have a lot of family medicine residents come in and they don't have any clue about the fascia. And when they start sticking needles in people, a lot of times they'll put a needle in somebody at a little bit of an angle, and the needle will always hang and kind of bend. And I'm sure you probably noticed that if you don't have it at the right angle, it's going to catch. That's because just underneath the surface of your skin, a thicker layer of skin is full of this really dense multi-directional fascia. And if you hit it at an angle, it'll kind of bind down on whatever it is you're sticking through. Whereas if you go straight through, point, you can punch right straight
and
through.
pop it in. You can feel the pop.
Yep.
We stick a lot of needles in people.
Oh, heck
as well.
yeah.
And when you do that, you feel that pop. You're penetrated that fascia.
Yep.
Very important.
Yeah, because if you don't, you can go like, and but thinking about the knee, thinking about things that we see every single day, real quickly, like trigger points.
Yeah.
Why do people get trigger points? Everyone that listens to this podcast, and every single person that listens to this podcast, that they know they have trigger points somewhere.
Yep.
Why do you have trigger points? Why do you have trigger points in the back of the shoulder or in your lower back? On your knee or in your calf? It's because this fascia is getting bound down, because the tension on that spot is not fluid.
Yep.
So you're getting these inflammatory things inside there. You're not getting this smooth movement of the fascia. It's creating tension. And that's what we try to turn loose with the acupuncture,
Yep.
with the stimulation, with trigger points, with cupping. Use cupping a lot for
Yep.
I mean, and I use a moving type of cupping, I'll put coconut oil, typically on the skin, and put that and run it right along this fascial plane, and right along the muscle, the angle of that muscle, pulling that fascia off of the bone, stretching that fascia inside there, and that in addition to a kind of a more traditional massage really seems to work even better.
Yeah, I think the cupping, which Ernie does a lot in our office,
absolutely,
is very, very essential, because you're right, it pulls that fascia that's stuck down.
Yep, it's locked.
You
it's
got to
frozen.
think too. You got your lymphatic system that flows through this fascia. And if it doesn't flow right, it's bad. It's bad for your health. You don't get rid of toxins.
Well, so the lymphatic system has multiple different types of fascia too. So the lymphatic system itself has a little bit more rigid type of fascia, where the lymph nodes themselves are really soft. That's why it's so crazy if you've ever had a lymphatic massage, and a lot of people say, well, heck, they were just barely touching me. Well, there's a reason. It's because it's a soft tissue. If you push on it too hard, you're going to damage it. It's just a different kind of fascia.
Yeah.
It's just fascinating. So I've really enjoyed digging into this and seeing the multiple layers. And again, I'm trying not to be too excited and talk in circles, but we were just talking earlier about compensatory type pain that you'll get from fascia, because again, the fascia, it helps you with movement, it helps you with structure. It helps you with communication. So if you bend over to tie your shoe, that fascia stretches. The little nerve endings are sending impulses to your brain saying, "Hey, you're going here," and we call it proprioception, but that's really what helps us with that. One thing we'll see a lot are these compensatory movements, and if you think about different forms of fascia, the lungs. They have to be a really kind of loose fascia that moves in multiple directions, but it's surrounded by a more dense fascia, because you want your lungs to stay in one shape. But because as you create this vacuum and you breathe, it's pulling these lungs up against the pleural cavity. And if you have some kind of lung disease, COPD, we see a lot here, black lung, emphysemas,
Pulmonary
asthmatics,
fibrosis,
pulmonary PFs, pulmonary fibrosis. The research has been great on why acupuncture is really good for those things. But now I think we're starting to understand why. It's because we're stimulating the different layers of fascia, increasing blood flow, increasing the hydration, but also working on the pain that you get. Almost everybody we see that's got these things, they have neck and shoulder pain because they're trying so hard to clear this space to create a vacuum, and they're doing this. So when they're doing that, they're going to have some kind of pain up here. So that's a whole different type of treatment, whole different kind of fascia.
Yeah, they're going to have neck pain.
Neck pain always, and so that's a lot of the treatment that I do. So.
Yeah, that's interesting. You work with the COPD patients a lot. But you're exactly right. They get that hollowed out area.
Yeah, that supraclavicular notch that and all it is because that pleural space that should be full of this fluid, that's this hyaluronic acid, not fluid, of course, but that allows the normal fluid movement of the lungs within this cavity. If it's not doing that, then you create this vacuous space inside there, and that's when you start seeing the suction in of the soft tissue, and then you see people with the rib pain and their intercostal pains and all of these other things. So that's what I treat a lot.
We see that a lot. See a lot of rib pain.
Yep.
Especially with the free floating ribs at the base. Seems like a lot of people get confused as to what that is.
Yep. And think about the different types of fascia that affect that. The fascia wraps, this is the periosteum, it's part of the bone. The entire bone, the matrix of the bone, is different types of fascia in there, But then think about how important that 12th rib is to connecting your upper half to your lower half, that
exactly
torso.
Right.
Yeah, so we've got a great big thick muscle there, that quadratus lumborum.
Yeah.
That QL. It attaches the bottom of the rib and the upper part of your pelvis. That thing is dense, it's thick, and it's got a fascia that goes one way. And you take it any other way, you're going to be calling me and saying, "Hey, Scott, my back's out." And we get them all day.
That's what that is.
That's exactly what it is. 99% of the time, it's not a herniated disc.
Yeah.
It's not, it's not anything else kind of crazy. It's not bony structures or anything like that. It's a muscle spasm, and you've taken that big fat muscle.
That thing
and
is so strong.
It's
if it's
so
pulling to
strong.
one side,
Oh, you're in trouble.
oh,
And
I've had it.
We've seen them walk in our office like this.
Yeah.
You know, you think, oh my goodness, and you know what's wrong with them immediately. You can kind of even grab that thing with your fingers, like, oh God, we turn that guy loose, he's going to be okay. But and what it is, you put needles in there, you put stem, or like you may do trigger points in there with bupivacaine or Marcaine or something or whatever. And even the act sometimes of not even putting the medicine in there, but just hitting that muscle will make it spasm.
I think it's
turn it off.
I think it's the needle.
It is the needle. Yep, it's the stimulation.
That's so interesting.
Isn't it crazy? So so there's a bunch of different fascia types. There's a bunch of different fascial reasons we have fascia. You know, to keep the shape of the eyeball. You know, to keep the shape of the heart. I mean, it's really pretty fascinating. So thank you for making me become a better student.
Well, I thank you for doing all the research, and I can't wait to the next podcast. I hope you guys can wait because this is going to be a good one. We talk about it, but how do you treat it? So that's the next subject. We're going to have a little more expose. People only have attention spans of about 10, 15 minutes. So that's why I try to keep these things short.
Yes, sir.
Unlike a 2-hour podcast, you get lost, you fall asleep.
No.
So this has been really great.
Thank you.
So we've delved into fascia, and we're going to start thinking about fascial planes and all that fascia does, which is way more than you thought it did.
Yep.
And on the next podcast we're going to have you back, and we'll talk about how to treat this.
Yes, sir. We'll pick out just a couple of the most common injuries.
Okay.
We'll do a lower back, we'll do a shoulder, we'll do a knee, and we'll talk about some very specific things. I won't be talking in circles so much next time, I promise. We'll be a lot more focused and direct, but we'll talk about the different types of fascias we're talking about and do a much better job of kind of giving people something to really work on at home. At home exercise, at home stretches, or certainly something you can take to your doctors and say, hey guys, I need some help here.
I just read a book called Supple Like a Leopard. I don't know if you've ever read that book. It's written by a physical therapist, but they talk a lot about fascia. And as we get older, we want to be supple. You know, we want to move through that plane. You're moving through life, and if you're doing it and you're hurting every time you get up or walk, you're going to get crooked, you're going to get debilitated, you're going to have chronic pain.
And you don't want to move.
It's going to affect your health. An otherwise healthy person with all the internal organs, their heart, but if they're not moving through those planes and they get off balance, they're going to have problems
Yes,
the rest
sir.
of their life, and it doesn't get better, it gets worse.
Yep, and the more you give to it, and the less you do, the worse it gets.
Yeah, you automatically kind of give into
You do.
it.
Yes, sir. We all do. We all do.
Look at people that walk, their posture. You can almost tell whose fascial planes are really off.
Yep. Well, and we've always said that we feel like probably whoever invented yoga probably had some lower back pain.
They did.
And got to moving and made it hopefully a little bit better. But we'll certainly go into movement and getting people moving through pain and maybe identifying what kind of pains you need to not move through and what kind of pains to move through.
I can't wait for that one.
Yeah.
Scott,
good.
thank you so much for coming on.
Thank you for having me.
tonight, and we'll anxiously await this next podcast we're going to do.
Looking forward to it. Thanks for having me.
See you, Scott.
Good to see you.
We'll
Thank
see
you,
you
guys.
guys next week.
Thank you.